Racism is an infection, an indoctrination that fails to recognize human dignity for all. Racial inequality affects the care one receives merely based on the color of their skin. It affects the kinds of schools people attend, how long they live, and the conditions in which they experience life.
To me, health equity means providing healthcare to everyone who needs it and making sure that no populations are left behind both locally and on a global level.
Social justice is at the core of public health because until we have anti-racist policies that impact all of the social determinants of health and address discrimination within healthcare, education, the judicial system, and environmental policy, we'll continue to see inequities in our health outcomes.
You'll see a lot of studies that say Black people are at an increased risk for this disease, or being Hispanic is associated with an increased risk for this condition, when in reality, a lot of these diseases or conditions or phenomena that we're seeing have no underlying genetic component that would explain those differences. But what we are seeing is the effects of living in a contaminated environment, not having access to healthy food, not having access to healthy and safe physical activity, not having access to a job that provides personal protection, lack of access to doctors that are really caring and providing equitable healthcare. All of those things are clustering in racial groups.
Racial inequality leads to extreme adverse health outcomes. And if we're to be honest with ourselves as public health professionals, as Americans, and as global citizens, where there is racial inequality, an overall healthy and happy society or humanity just cannot coexist.
As a public health professional, social justice is my work. Social inequities beget health inequities, which is why the field of public health has such a necessary and an urgent agenda to address everything from environmental health to racism and everything in between. If we truly want a fair and equitable society, we need to really think about what that means for public health, because this is not just about affording your insulin or controlling an outbreak. Every aspect of our society, including the policies and the laws that we make, affect the health of the population.
We as public health professionals must support actions at all levels to provide all people with equal access to education, employment opportunities, healthy foods, and quality health care. As we reflect on what is going on in our nation and the world, let us remember how interconnected we are. It is time for us to not only worry about ourselves, but to also worry about those around us.
Health inequities,
Racism,
Racial disparities,
Racial inequality
is a public health concern.
we must all take the responsibility of ensuring equality for all.